Welcome to 843 TV. I'm your host, Lisa Richardson.
And I'm Catherine Mademan.
And today we are at the Encompass Health Rehab Hospital located on the 170.
It is a beautiful facility and it's brand new.
It absolutely is. Share with us about our guests today.
Our guests today are Renee Bannon, who is the Director of Business Development, and we have a patient visiting as well, John Bates. We also have Ryan Dromsky, who is the Director of Therapies, and Dr. Samoya, the Medical Director.
So we're going to be learning all kinds of things about their services they offer and all about their one-year anniversary coming up.
June 20th, and here between 4 and 8, we highly recommend you to come in and view the facility. It's beautiful. I'm excited.
So stick around for this episode of 843 TV,
where communities come to speak.
.843 TV, where the Low Country comes to speak.
.843 TV,
where communities come to speak. Welcome to 843 TV. We're here at the Encompass Health Rehab Hospital on the 170, and joining us here up first is Miss Renee Bannon, RN, and also you're the Director of the development here in this brand new facility. It's such a great place that we're learning all about. Share with us some of the highlights, some of the main things that happen here.
Absolutely. So we are an acute inpatient rehabilitation hospital. So we offer very specific, very specialized inpatient rehabilitation for patients that have had acute events in their life that have obviously changed their way of life. And in order to get them back to their level of independence that they were before, we focus on the rehabilitation that's necessary for the patients to get back.
I love how you put that, to get them back to the level of independence that they were at once at, because that's such a big thing as far as rehabilitation.
Yes,
and so
absolutely.
Yes.
You know, this facility being 1 year old, and then we're still learning about the location. You're right here on 170. Outside the gate of Sun City,
yes.
So I wanted to make sure everybody knows where you're looking.
The back gate of Sun City.
The back gate of Sun City.
Yes.
So that's really important for everybody to know. But I know unique in this facility is that the acute. So when we're talking about the acute, what patients are coming here to see you after they're at the primary hospital? Tell us about that.
So we treat a wide range of conditions. Some of the main conditions that we treat, of course, are stroke, hip fractures, amputations, spinal cord injuries, neurological conditions such as Parkinson's and multiple sclerosis. So there is a broad range that we do treat. And another key piece to that is that the acute care hospital is not the only avenue for patients to get to our hospital. We are actually able to admit patients from home, from the physician's office, and also from the acute care hospitals because we are licensed as a hospital. So there's some key pieces to that criteria that really separate us from some of the other inpatient rehabilitation facilities in the area, such as the skilled nursing facilities.
Okay.
Oh, that's really unique.
So they don't have to necessarily be released from the hospital here. They could come from the doctor here.
Right. A lot of the skilled nursing facilities actually require a 3-night hospital stay and a PPD to be placed in order to qualify for an admission to the skilled nursing facility. And because we're licensed as a hospital, we do not require that. So we have the privilege to admit patients, like I said, directly from the hospital, even if it's only from the ER, from the patient's home. My team can go into the patient's home and do an assessment to see if they meet the criteria for inpatient rehabilitation. And of course the physician's office, if the physician calls us and says, hey, my patient is struggling with this, we can come and see if they meet that criteria.
I just want to be clear, make sure that we're not an ER, but we have the ability to take patients with acute care who needs care.
Yes.
That's really unique. I think that's super special to understand that.
Absolutely. We are not an ER. We're not looking to replace an ER, but we are looking for folks that have a stable condition that is new, a new onset, that we can that also need, of course, the rehabilitation piece as well.
Of course, this lovely gentleman joining us here, Mr. Bates,
Yes.
you were someone who have really benefited from the facilities here. You were a stroke patient. Tell us a little bit about your story.
Okay, well, my wife and I came down here in January. We were going to spend 3 months at Hilton Head.
And the fourth day that I was here, we had played tennis that afternoon. I was cooking dinner
Okay.
and had a stroke. I was cooking, and all of a sudden I was laying on the floor, totally incapacitated. And my wife called the emergency, and they got me into the hospital. And I spent 5 days in the hospital. And while I was there, towards the end, the business development manager met me and got me referred to this facility. And that was a godsend. I didn't know, we were here, we didn't know anybody. I mean, talk about, fish out of water. We came from Townsend, Tennessee in the Smoky Mountains. So we didn't know a soul. And they made us feel so comfortable, it felt like coming home.
Wow. So you were at the hospital for 3 days first, and then you were transported up here for an additional 7 days?
Yeah.
So during the 7 days, tell us how your experience was. Tell us the day.
Well, the first thing it was that I had to find out, because I just had the stroke, begin to realize who I was. It was a long, slow process, but here they took real good care of explaining where I was at, what I was doing, what the process was, and gave me the assurance that I would be okay. Because you don't know that at first. You don't know if you're going to survive, or if you are going to survive, if you even know what your name is. So that was the big sin to me, was that there was reassuring that I would be back to normal. I would be back to doing the things I needed to do, and they had the staff on hand in the rehabilitation with physical therapy and occupational therapy and speech therapy that handled all the things that you need to get back to doing. They were able to do that, and not just do it because that was their job, but to do it because they cared about me. And I felt like, I had come home. As a matter of fact, the feeling of coming home was so great that I decided to move here. After spending a week here and then several weeks in outpatient rehab, I made a decision that, everybody here is so kind. Why would you ever leave?
Yeah.
And so we made the decision that we would move to Hilton Head, and we have done that.
What a fascinating testimony that whole thing is. That just shows you that life happens and you never know what it is. Here a couple of days and this happens. So that's just an amazing
And I just
story.
want to double check. So now you're independent. You're back.
I'm
to
back
life.
independent. I'm out swimming every day, just about, riding my bicycle all over the beach, walking with my wife over the beach, and hopefully at some point I'll be back to playing tennis.
Wow.
That's the only thing I'm not doing yet that I used to do. That I know that will come.
Well, you just
It
gave me
will.
the
You'll get there.
goosebumps.
Yeah,
I know.
I love
Good to
hearing that. It's lovely to have you join us, John.
Oh, thank
Yeah.
you.
And Renee, thank you too.
Absolutely.
I know there's so much more we can learn, and we'll hope to do
Yes.
that when we come back. Just real quick, is there a website, or where can someone go to find out a little bit more in the meantime?
Yes. Please contact us at our main number, 843-836-8200, or our website is encompasshealth.com/Bluffton Rehab.
Great. Well, we're going to be back for some more 843 TV.
And we are back. I am with Ryan Dromsky, who is the Director of Therapies, and we are in the therapy gym. And what's unique, Lisa, look what I have on. All right, Ryan, we have to talk about this because this is unique to your facility as well.
It is. This is the Biodex system, and what this does, this is a balance system which allows the patients to walk freely, but they're secure in a nice little harness here. So we can walk around the gym without having two people on somebody. One therapist can walk safely without the fear of falling, and they can facilitate whatever different movements they need to do.
So what kind of patient would be in a harness like this? What are you recovering from?
Typically, we would have a stroke patient, or we'd have somebody who was debilitated from a fall, or they had a hip fracture. We're doing some early weight bearing, and we could put them in this harness, and we can actually pull on this a little bit to off-weight them, which is a little bit nice too, to get that early ambulation.
Interesting. So it's at somebody is like regaining the ability to walk, like you
Sure.
said, strokes, maybe
Absolutely.
something from a car accident, a back injury, a hip injury, a knee injury.
They all apply. Anybody who needs to get up and ambulating early on, we want to put them in the system, especially when they're a fall risk.
All right, let's take a little walk, if you will, check out how it works. And as we're doing that, share with us a little bit about what acute inpatient therapy is. How does that look like as far as rehab?
Well, it's a little bit different from this area because this is the first one in the Bluffton area. We are a multidisciplinary therapy department, so we have speech therapy, occupational therapy, and physical therapy. So all three disciplines are working on the goal to get the patient home as soon as we can. So our therapy is designed around function and function only, and we want to make sure that anything that you did possibly at home, that we recreate it or simulate it here. So that makes us a little bit different. And they're required to have 3 hours of therapy a day, so they're getting a tremendous amount of therapy during their time here.
And that's unique to this facility as well, you know,
It is.
because the kind of care that you are having here is 3 hours for sure, and then it's 24/7 all the time care with nursing and a physician on staff, and so it's a unique environment for somebody who is recovering from an injury, a condition of some sort. But in this therapy, Jim, there's a room over here that's a real kitchen, and that's
Yes.
where you're sharing with. We do a little OT, right?
Absolutely.
Tell us what happens in there.
Well, in the kitchen we have washer and dryer, full working kitchen, dishwasher. We have a full bathroom with a tub, so we can work on people who have tubs in their homes. We can work on their transfers. We can get them cooking, cleaning, dressing, folding. Anything that you would do at home, we can simulate that here to get them ready to return there.
You know, I remember when I was reading the copy, you know, you really are excellent at helping stroke patients. And, you know, those seem like simple things to do, but for a stroke patient recovering, it's so important because that's life. And they have to regain. And then they said, well, in the first 3 months of recovery of a stroke, that's where they sort of regain their abilities
It is
and
true.
capabilities. Could you tell me a little bit more about that?
During that initial time after you suffer from a stroke, a lot of times whatever deficits you may still have, we have to work on them early, because after that 6-month period, like you said, you're kind of almost left with that, and you have to work on that throughout your lifespan. But early treatment will definitely help reduce your deficits going forward.
So patients you have here are here sort of as an intermediate step once they get released from the regular hospital. You're also a hospital where they can go home. How does that process work? Do they have to be recommended by their physician? Share with us how that might work for a patient.
Generally speaking, in the acute hospitals, case management's working diligently to get them to go somewhere else.
Right.
And generally speaking, we're kind of that nice fit from them from going from acute care to home, because we can provide all that therapy that they need to get them there. So it's really the case management department in that acute care hospital that's contacting us directly, and then we're going out to see that patient and then bringing him into our hospital.
And you're one of a kind in our area, right?
True, it is true, yes.
You know, along with this, there are other modalities that you have here that are unique. Peter Pan.
Are you having fun in there, by the way, Kathy?
Well, when they go like this and I gotta go this way, we'll see what happens. But let me ask you, so in another room, there's a couple
Sure.
other machineries that are really important. You know, you're sharing with in getting your hand-eye coordination together, and the computer screens. I mean, this is really state-of-the-art technology.
Absolutely. Encompass Health really focuses a lot on their technology. They invest a lot of time and money on the R&D behind some of this technology. So what they want to do is supply the therapists with whatever they can so we can get the best outcomes possible. So we do have some touchscreen systems that can work on cognition, eye-hand coordination, sequencing, a lot of things that you'll have a lot of deficits after a stroke or a traumatic brain injury. And then we also have some gaming systems which are very creative, I would say, for those patients to keep them involved and also moving their extremities when they have those deficits.
Well, that's sort of a mind and physical
Sure.
rehab. And I think it's neat to note the wall here. It's like a wall of encouragement with words. So it's, again, a mental encouragement with restore, ambition, aspire, all those things that will be helpful in their mental process of not just physical rehab, but mental.
Correct. During the rehab stay, between nursing and therapy and even case management, we're all trying to encourage that patient to get through their day, to encourage them to move. A lot of acute care, they're in their room, they're not leaving their bed, but here we're kind of working on those transfers to get them to a commode, to get them to the bathroom. So
Right.
they're really working on their rehab the whole entire 24 hours they're here.
Interesting. So along with what other conditions or modalities that you have here that are unique that you want to share with us? In that room, there's other things I saw.
Well, those are the two, but most of
Okay.
our technology is in there, but I would like to point out the outside area, which is highly used, and we can probably see a little bit of it, but we have all different surfaces out there. Tarmac, brick, cobblestone, decking, and we have curbs. So a lot of our therapy does happen outside because most of the people are gonna go home and they're gonna want to ambulate and go in the community. So we have to really simulate those ramps, the decking material, which is a nice feature, and it motivates the patients when they're outside and that sunlight.
That's so neat because if you think about it, you're just
I've
going to
never
the
heard that
grocery
before.
store.
Yeah.
You're going to encounter all those surfaces.
Absolutely.
So, very
Yep.
neat.
we
And you
can-
help them learn about the shoes they wear and the traction and things like that? Is that part of-
Education is a key component to our rehab, absolutely. We educate on all different things, their precautions, their shoe wear, their fall risk, and we want to get family involvement too. We want to get most of the families in here as soon as we can, especially if they need caregivers, to get them to be able to function with them at home.
Well, there's so much to learn here for sure in this rehab room, and there's a lot more to learn here about the Encompass Rehab Hospital. So you stay right here. We're going to be right back with more 843 TV. Welcome back to 843 TV here at Encompass Health Hospital, and joining us now is the medical director, Dr. Samayo, and you're a native to the Low Country, so welcome.
Well, I've just relocated here from New York. I have 16 years of experience in acute inpatient rehabilitation, and Encompass recruited me to come down and be the new medical director of this beautiful facility. So,
And beautiful it is, isn't it?
It is. So welcome to the Low Country. Your specialty is in strokes, and this is actually a hot topic that I would like to talk to you about because the facility is really known to how to care for patients who's had a stroke. Start us off with somebody's had a stroke and they've come to here from a primary hospital to have rehabilitation, and then what happens with that patient?
So we provide a much higher level of care than the nursing home type rehabilitations. We are able to do 3 hours of therapy a day, 5 days a week. That's the recommendation of the American Heart Association for stroke recovery guidelines. And that's what separates Encompass and acute rehabilitation from the subacute facilities that are common.
So what other complications after having a stroke were we looking to help this patient recover from? Tell
Yes, so when someone has a stroke, it can affect them physically. They can have paralysis, they can have paresthesias or funny feelings in their hands. They can have balance difficulty, they can have visual difficulty. They can also struggle with things like bathing, dressing, just brushing their teeth and combing their hair. So we address all of those things. In addition, they can have speech problems, and we have speech therapy here, as well as difficulty just communicating in general.
Absolutely.
How long does a patient stay here? Are they here for quite a while until the conditions get better? I mean, what's this?
It depends on the severity of the stroke. Some patients may be here only about 5 or 7 days, others may be here several weeks. Our goal is to get people from the acute care hospital to home, and we try to do that in about a 2 to 3 week window for strokes.
So you've just been here a short while.
Yes.
In your brief experience so far, share with us a little bit about the patients you've interacted with and just in general.
We've met some wonderful people. It's a different part of the world from what I'm used to in the Northeast, so people tend to be very, very sweet, very outgoing, and able to discuss lots of different things with you. And we've seen a gamut of different injuries, strokes, we've seen falls, we've seen just a lot of people that need to come through acute rehabilitation.
What about folks recovering from maybe injuries after accidents or anything like that? Do you see some of those
Absolutely.
patients?
We see car accidents, bicycle accidents, falls from ladders, any type of trauma are things that we would definitely deal with.
You hate to say it, but in this area, there's a lot of that just because of the outside nature of the area.
Well, I was at the Hilton Head Hospital about a month ago, and I was talking to the ER, and they said, I asked them, what's the number one accidents, and they see are bikes.
Yes.
Yeah.
The number one is bike, broken bones, and then the biker without the helmet.
Absolutely.
And then there's a head trauma involved.
Correct. In head trauma, traumatic brain injury is a very common diagnosis. Everything from concussion to the more severe injuries that kind of mimic strokes.
Yeah. And so as a practitioner, what are you passionate about? Obviously you love this part of the medicine.
Yes, this acute rehab is unique. You have a multidisciplinary team. You obviously have physicians, you have wonderful nurses, you have physical therapy, occupational therapy, speech therapy. We're going to bring in neuropsychology. So you have a whole gamut of teams that all work together to really get these patients back home, back to their regular life.
Share with us about the rest of the staff here as far as the medical staff. You obviously oversee that you're the director. What about the physicians and how does that break down?
So right now, you know, I'm the medical director, and what we're trying to do is build relationships with all the local community hospitals. We have several different physicians in the community that come give us support, but it's a matter of building these relationships with the hospitals and allow some of those clinicians to come in and work with us.
Yeah, but it's, you know, I'm excited for you because I can sense that, you know, you really have, as a practitioner, you have a chance to really make a difference in so many people's lives. And the team around you, you know, it's deep. And it's all inclusive.
It's wonderful. You almost become part of these patients' lives.
Yes,
and,
absolutely.
And you know, even after you send them home, a lot of them come back, and a lot of them are very thankful because you've really made a difference during one of their most difficult times.
Not just for the patient, but the family members, the caregivers. And in a lot of cases, a lot of them may not be here because of the nature of our area. People have retired and settled here and their family is up north. And so just the peace of mind knowing that there's a facility that can really help is, I'm sure, a huge added value.
Oh, without a doubt. I've been very impressed with the facility for sure.
Absolutely.
Well, I want to say thank you for joining us.
Thank you very much.
And we've learned a lot today here at this facility, especially in this great room. And so we're happy that you all joined us for this episode of 843 TV.
Where communities come to speak.